Now we have the last workshop of today, foot and ankle workshop. And for that, I invite Dr. Anatoly and his team. I invite Dr. Bari also to come on stage if he's here.
So, dear colleagues, I know everybody is tired, but it's last hour step. So, and now we will try to talking about what we can do by Elizarov in the foot and ankle surgery. So, and main functions of Elizarov for foot and ankle surgery, that's especially our view. It is a stable fixation, gradual control for position of the bone fragments, and minimal invasive and early function. So, and in the next slide, I will try to show how we can put the wires on the anatomical position on the leg and foot and ankle places. So on that slide, options for placing wires through the tibia bones, how we put wires on the hind foot, especially from the calcaneum. We like to put wires with only parallel wires, and sometimes from the tuberosities of the calcaneum, like in that view. So in this slide, I show variants of the wires, how we put wires on the bones of the forefoot. It can be from the lateral to the medial side, and from the dorsal side, console wires, key wires, as you like. So, and that position of the wires can provide to us make rules of the single bones of the foot on the forefoot place. So, and in that slide, typical decision of Elizarov frame for foot and ankle deformity correction. And one important here that decision of the frame of the Elizarov frame is can be applied in all types of and kinds of foot and ankle deformities and pathologies. So, kinds of manipulation with Elizarov which we used. Of course, first of all, it's soft tissue release, osteotomies and arthrodesis. And if you're talking about of the soft tissue release, we used in our practice Achilles tenotomy, lengthening, shortening of the ligaments, tenodesis, and tendon transferring, like in that slides. Elchilotomy by Bayer, by Elizarov, variant of the plantotomy, which we used in our surgeries. So, and on the next slides, levels of osteotomies of the foot bones. And for example, osteotomy of the talus neck, like in that picture, and talus body osteotomy. Especially we used the technique for in cases with some deformities, deformity correction of the ankle joint, variants of the calcaneum osteotomy, calcaneum neck osteotomy, calcaneus body osteotomy, variant of the figure osteotomy, like V-shape osteotomy, variant of the osteotomy of the hind foot bones, variants and types of osteotomy of the tarsal bone, bone places like symbol cuboid bone osteotomy, separately osteotomy of the navicular and cuboid bones, and osteotomy of sphenoid and cuboid bones. Especially that osteotomy we using for foot lengthening and sometimes for deformity correction. Variants of osteotomy of the metatarsal bones for lengthening, for correction deformity. So another one variant of the figure osteotomy, articulated osteotomy of the hind foot, like a hinge osteotomy, especially that osteotomy we using in cases with ankle deformity and with ankle disabilities. So, and kinds of arthrodesis which we used with Elizarov. For example, full arthrodesis of the panarthrodesis of the joints, subtalar arthrodesis, ankle arthrodesis, triple arthrodesis. So, and what is the rules which we used when we apply an Elizarov frame on the foot and ankle? Especially it's important in diabetic cases. First of all, it's half hybrid fixation, half pins and wires construction. Especially we try to use that type of decision of Elizarov in cases with osteoporosis, because we trying to create more strong fixation on the leg part of frame. And in same case, we trying to save free space between half pins and wires, minimal 15 millimeters for protection of pin track fractures. Today we saw the same fracture. So minimal distance between internal side of rings and surface of skin on leg should be minimum 15 millimeters. That's important for protection of compartment skin around the wires, around the ring, yeah, sorry. Variants of the hybrid half pins and wires construction on the calcaneum place, and very important that in cases where patient have a high weight body, we trying to use wires 2.5 millimeters. It's very important for safe, stable fixation of the ring. And here is view how we used offloading of plantar foot in cases with ulceration on the plantar surface. So, and last time we started to use it changeable size of frame for foot for prevention compartment of soft tissue. How we applying for a 4-foot frame, U frame with changeable size, hind foot frame, and our Elizarov set for foot and ankle, which we used in our practice, and small video, how does it look. That set is too comfortable for using, because it's not take a lot of space on the surgical table desk. Yeah. And which one possibilities of Elizara for treatment of the foot and ankle disorders we can, what we can do? First, correction of deformities, like in that case, patient 35 years old with spina bifida sequela was admitted in our department with that kind of deformity, equina cavavarus deformity, and on the plantar surface ulceration. So his X-rays showed total defect of the fifth metatarsal bone and arthrosis of the joints. So in the first step, we was done debridement, deformity correction gradually, and especially by Elizara frame. Sorry. On the next step, when we correct, when we was done fully correction of deformity, we was done second step, triple arthrodesis. And of course, with little bit changes of Elizara frame on the surgery. And follow up, here wrote 1 year, but actually it's more than 5 years now. Good result, patient can walk, not have recurrence of deformity or ulceration of infection, anybody. So another one, interesting possibilities, it is a healing bone defect. Like in that case, patient 32 years old, after traumatic injury of the hind foot, was admitted in our department with total hind foot bones defect. And for healing that bone defect, after sequestral necrectomy was done Elizara frame, Elizara fixator, and was made osteotomy on the proximal side of tibia, and then was started bone transporting in hind foot bone position. And after creation enough space of the bone tissues in the hind foot, like here, we was done osteotomy on the distal side of tibia for creation new calcaneum. And that technique we called calcanization. And now historically, we have more than 13 years of using that technique. And now it's more than 25 patients with a which one was saved his foot. Yeah. And especially tomorrow in my presentation I will show more same cases. Next possibility of Elizarov, that's arthrodesis of the ankle joint and other joints, like in that case, patient with osteomyelitis of the ankle joint, with osteomyelitic necrotic process on the talus. In our department was done sequestral necrectomy, osteosynthesis by Elizarov, and for lengthening was done osteotomy on the proximal side of tibia, and at the same time was done lengthening and correction of the shortening of his leg. Another one possibility of Elizarov on the foot and ankle is lengthening of the bones. Like in that case, a patient was admitted in our department with that local index review. Was done osteotomy of the first, third, and fourth metatarsal bones, and was done lengthening. And final result, good result. Yeah. Another one possibility, creation of new arthrosis and or arthroplasty, as you like. Patient with osteomyelitic necrotic process on the talus. In our department was done sequester necroectomy, subtotal resection of the necrotic talus, and for creation and for a safety function on an ankle joint place was done osteotomy of the tibia like a hinge and osteotomy of the calcaneum bone like a hinge, and then was made osteotomy for healing that bone defect. And important here that we don't try to make arthrodesis between tibial bone and calcaneum bone. We are trying to save a free space, something around 10 millimeters, for creation like fibrous tissues. And because we are safe function, you can see plantar flexion and dorsal flexion, not bad, I think, especially in case where was before infection process. So, and soft tissue possibilities, it is creation or correction foot deformity, correction foot deformity for stitch and wound, like in that case, and opposite creation foot deformity, equinus deformity for stitch and that wound on the plantar surface. And of course, after stitch and wound, after healing soft tissues, gradually and after 1 month of fixation in equinus position, we have started deformity correction and reposition of the, in that case, reposition of the foot backside again behind the tibia for creation new points of the pressure and for prevention recurrence of ulceration or on the hindfoot place. So, and simple possibility, protection transported skin flap by Elizarov. It's very useful technique because it can make offloading of the transported skin graft and can give to us more comfortable change of dress in postoperatively. So, and finally, which one advantages of Elizarov method can give to us? Extra focal stable fixation of the segment, control of bone fragments, gradually correction of bone fragments, improvement blood in supply segment, elimination of the infection process, and prevention recurrence of infection and deformities of the foot and ankle. So, and I hope that everybody would like to visit our center, our conference in June, and pre-course before conference. Please take a picture of that slide. So, thank you for attention. And now I have one question. Because we have foot bones without some deformities, I think will be better if you will tell me which one deformity we will try to show how we do correction, or maybe some defect you would like to see. What is kind of pathology of foot you would like to see on the master class? Please. Equina calavirus, right? Okay. Yeah, okay, good. So let's start. So, and as you can see, for a safety time, my colleagues to help me and to create Elizarov parts frames on the tibia side. And for it's very safe to our time. And now we will start to put wires on the hind foot and forefoot and forefoot. So actually, I would like from to start fixation of the foot, and would like to start put wires from the hind foot. It's more, да, давай вертолет. Нет, там есть другие.
Longer.
Не, longer, not.
Ленина растет.
Не, нормально, не надо так. I would like to start to put wires from the hind foot, from the calcaneum, and in my experience, I try to put wires only parallel by the axis of the calcaneum foot, calcaneum bone. Да, нормально. Sometimes when we have osteoporosis on the calcaneum, we can put from the Achilles tendon side of calcaneum one more K wires or half pins as you like. It's possible. So usually we for fixation of the hind foot using 3/4 of the half rings, like something like that. Да не, нормально. Гайки, надо.
Stick paid with the
Видел,
female
как ты
post.
Нормально. Шарниры надо будет.
One male post and one male and one female.
Yes. Give me hinges.
Actually, equina calavirus deformity looks like something like that, right? Yeah. And because we don't try and in same cases to make acute correction. Of course, if it is in cases where is patient not have some ankylosis of the subtalar or some other joints of the foot, we can do a little bit deformity correction, especially especially how it's applicable for skin of the skin.
Yes, I want.
Что-то не заводит.
Сколько шагнет?
5. А так здесь же есть эти карданные.
Одна плоскостная. Два двухплоскостных.
Ну этих 3 у тебя же, да, все, хватит.
Этих еще два.
Все, отлично, больше не надо.
Что, крепить?
Да, да. Давай тут затянем сперва.
Хорошо.
Длинную гайку.
Long nut, super max. Long nut.
Я.
Вот какая красивая она у них.
Да, она для удлинения. Что затягивает? А там с одной стороны крепи.
Кантер.
Can he walk on this freight? Can a patient walk on this?
After deformity correction, patient can walk with the frame, and and it's one important condition that after deformity correction that patient should be start and should be walk in the frame. It's important for faster healing wound, faster healing bone, and fusion of the bones.
In case of fractures, he can walk.
Yes.
Yeah.
In pilon fractures, he can apply in pilon fractures.
And as you can see, I didn't try to use automatic wire tensioner, just simple Russian style.
Pilon fracture, mein there will be ring over here in pilon fracture.
Yes, they enable for early
That
baby.
is semi-open procedure. Semi-open procedure in pilon fracture.
Depends from the fracture.
No, there is pilon fracture. I mean intraarticular fracture here.
Yes, he can walk.
And we have to open it to construct the joint.
Sometimes.
Так. Сейчас закрепимся. So actually, You can see parallel wires fixation is too strong, not moving.
We can use olive
Yeah.
wire here. Can we use olive wire here?
Only wire?
Olive wire.
Olive wire I didn't like to use in food and because, as you know, давай. As you know, food anatomical region where anatomically we don't have enough soft tissues, like in femur, for example. And because olive wires on the calcaneum place, for example, sometimes can give to us some complications, like some inflammations around the wire of the skin. Now we will fix hand foot. Что ставь как-нибудь?
По бокам?
По центру один.
Хорошо.
Может, за место этого болта взять.
This one. Yes, yes.
Sorry?
Location of village.
Подожди, у нас дислокация. Вывих. Что я тут нахер? Да. Сейчас я закреплю.
Да, пожмите один.
Давай зажимай. Закрепляй.
Если can perceive.
This
No,
will
no.
act as a motor.
Sorry?
This hinge will act as a motor. This structure.
What do you mean, please?
I mean, this will increase the distance between these two things.
Yeah. Right. Вот так. Подожди, убирай эту.
Надо этот поменять.
Стабилизирую эту сторону. Да, длинную ставь.
Three hole mail. Sorry, four hole mail. Four hole mail.
Ты уже использовал их, нет? Так, где у нас еще один был такой же шарнир?
Где ты делал?
So now we have fixation of the hind foot place, and we have some preparation for correction of the deformity of the hind foot. And now we'll starting to put wires on the forefoot for correction of the forefoot place. We understand that deformity looks like something like that, right? Yeah. So let's start to put wires. двиги.
I think it is better to you will not penetrate. This has been only one single one.
Ладно.
It will be two wires.
Two wires, two ones.
И последний на выносе. Что последний еще сунем с выносом.
Флажка?
Да. Да, пойдет.
Give me two whole mail, please.
And washer with,
Here it is.
yeah. No. Yeah, washer. Yeah, that's one washer. So mail. Two forms. Yeah. Блядь, какая-то говёная, блядь.
Давайте я сдвину.
Все, давай, двигай. Все, окей.
Так, давайте я обожму со своей стороны.
Подожди. Я затяну, а потом ты.
Вот это натягивается нормально.
Ну, все. Сейчас сразу загнуть, чтобы не мешало. Так, вот эту натягивай. Эту затягивай. Все остальное я натяну.
Работаю.
Давай. Похоже, шайба какая-то говёная просто.
Вообще не зажимает.
Ну,
उसमें टेंशन नहीं will you not apply a tension
One more time.
in these wires?
We're trying to get first, second, third metatarsal.
yeah.
Firstly, you have, now are you going to apply tension or not? I mean,
We don't understand you.
tension you are applying the tension or not? Tension by tension or?
Yeah, we usually used Russian technique for tension.
You are applying tension, no?
No,
in wires, you are not in better water.
no, only like by hand.
You don't want to tension.
Yeah, don't use, because it's take a lot of time.
I mean, you are applying resting technique, no?
Which
You are
one take?
applying resting technique to tension the wires.
Yeah, especially that technique, especially. So and finally, it's not take a lot of time. And now, last one step to put twisted rods on and fixed forefoot with hinges. Yeah, да. Long rods, yeah.
Куда они встанут? Ага. Понял.
Yeah. Ну, типа у нас Аквинус. Раз речь об этом. Давай фиксируй. На дыру надо переставить. Ну, Иван, пусть так. Давай, так пойдет.
Мне кажется, пойдет.
Пойдет. Крепит, говорит. И вот это поверни. Флажок поверни чуть-чуть.
Какой?
Вот этот. Чуть-чуть. О, супер. Так. Коробки. Один коробки у них есть.
Give me short bolt. Short bolt.
So enough. So, and finally, we are prepare a typical frame, Elizarov frame for equine coronavirus deformity correction, equinus correction. We need to add here another one rods with for correction of the covers deformity. And finally, everything is done.
One hole go.
Yeah.
Uh-huh. And the longest rod. Oh, I know.
No, it's one more rod.
Prepared the hinge with two female posts.
Just give me a plank. Shock plank.
So, and now I will put last rod with the hinges for cow's correction, deformity correction.
side.
Не надо, с одной стороны. From the opposite side, we didn't put same rods, especially because from that side, sometimes same rods can be make some troubles for correction, and sometimes it can make some other deformities on that place. And because I like to use only from the one side same road, same road. So, and finally, in that surgery, we make all preparation for gradually correction of the foot and ankle deformity. Sometimes if we see that in ankle joint position and position of the talus is normal, is okay, for protection of dislocation of the talus, we put one more wire and fixed that wire on the ring, on the distal ring, on the tibia. It's very important for protection of the ankle joint and for protection of the dislocation of talus in cases where talus position is normal. In other cases where when talus position is staying in deformities, or sometimes if talus is or is ankle joint is have some disorders, we didn't try to save that. We make in post-operatively, we just make deformity correction, and then second stage, arthrodesis of the joints, which one work it in deformity. So, some questions maybe? Thank you very much.